We are ready! So last year when I was looking on YouTube for some tips and tricks for passing the GPHC exam, I came across a video and a person called Marvin, and his enthusiasm and willingness to help other people pass the exam just came across so well on screen. His videos really helped me. So I mentioned him in my first video talking about tips on passing the pre-registration exam. And then he invited me to be a guest speaker on his webinar. So the webinar's just happened and I did film it, but I wasn't looking at the camera. So I thought it was worth filming it again just to go through the points that I mentioned in the webinar. So I came up with 4 exam preparation tips and 6 mindset tips. The first examination tip is called the open and the closing. So every day open the day with 5 calculations, and I'm saying 5 because let's be real, nobody actually wants to do the calculations, and 5 is a number which you can walk into your community pharmacy or hospital pharmacy and just say, oh, do you mind if every day I quickly just do 5 calculations and then get to work? It's kind of like a manageable amount, and doing some is better than none. So if you start the day with calculations, just like you would start the day doing calculations in the actual exam, and then end the day, and this is called closing, end the day with past paper questions. Whatever you do between that is, you know, not up to me. Whether you go through the BNF, whether you come back home from work and don't want to do anything, just start the day with calculations, end it with past paper questions. Second thing is read the common mistakes that the GPHC exam releases. Every year they release a sheet saying this is what the candidates did wrong, and the likelihood is you're going to be like those candidates getting those questions wrong. I know that I definitely was. So read those and see what they want and see where they're going wrong, because that's when you can kind of figure out what tricks the GPHC are coming up with. You can see why the GPHC asked certain questions and why you answered them incorrectly. Have a little notebook and write down drugs that have major side effects. For example, digoxin with yellow vision, clozapine with constipation, sucralfate with Bezoar formation. These are things that as soon as you see the drug in the question, you'll be like, okay, bam. I know that with amiodarone, you're looking for a greyish blue tinge on the skin. Like, there's certain drugs that have major side effects, and you should really have a list of those and take it around with you. So when you're on little journeys or train journeys or whatever, you can just flip it and there's stuff for you to learn straight away. The final exam tip is do not forget the MEP. Honestly, I totally underestimated it because we had a law exam in the 3rd year and I was like, yeah, whatever, I'm sure I know the law, that's fine. But then in the exam you panic and there's little things that they'll ask you and you'll forget. So for example, one of the questions was how many days emergency supply can you supply this drug? And I was like, oh, I honestly just I could see the page where it was written in my head, but I actually couldn't remember what answer it was, and because the answers are all so similar, I honestly could not remember and I got that question wrong. Now I'm going to go through 6 mindset tips with you. Firstly, don't get obsessed with finding a job. If you don't pass the exam, then you are not going to be able to, you know, practice in the job. So focus on the exam. I know it's nice to think about having a job lined up, and if you can manage writing an application, then good for you, but don't get too carried away with finding a job because you can find one after you pass. And at the time where the exam results are released, quite a lot of jobs open because quite a few people fail. So if you haven't managed to secure a job for after your exam, then don't panic. Number 2, don't waste time making ridiculous timetables that you're not going to stick to, because you're actually wasting time. You could be revising by the time you've come up with this amazing timetable, which is just unrealistic and you're not going to follow. For example, don't be thinking, oh yeah, I can finish like the cardiovascular system within like 2 days. It's not going to happen, and you're just going to feel more disheartened. Rather than set an unrealistic timetable, actually just get on with the studying. Number 3, don't compare your progress or your position with others. Don't be thinking about, oh well, my friend's in hospital so she's going to be learning more, and this person's going to this training course so they're going to be learning more. Again, you're wasting time. Your progress is your progress and everyone learns differently, and this is your own journey to becoming a pharmacist. Number 4, don't even consider or think about pushing the exam back to September. It's so easy to be like, oh well, if I'm not ready for this one, then I can just push it back to September. All you're doing is pushing back the work. If you just push forwards and think this exam is happening, this exam is happening, and don't even give the September exam a thought, then you're going to be much more productive and you're going to get so much more knowledge into your head. In the month of the exam, try and study every day. I know that it's really annoying and you probably won't want to, but honestly, it's so important. Just even if you're doing little things, even if you're flicking through one page of the vaccines of the BNF and it's a tiny section, just still do some work, because some is better than none. And number 6, feeling anxious is totally normal, and the only way that I got through this feeling of anxiousness is basically by revising. So I'd lay in bed and think, oh my god, my life depends on this, I'm so anxious, I'm so worried. And the only way to get through that feeling was to actually get up and do some questions, then go back to bed. That's the only way I felt like I could conquer my anxiety. So if you are going overboard with anxiousness, just sit and revise, because the moment you open some books and start studying, that's the moment you'll stop feeling anxious. Some additional tips are, don't just use one source, don't just use Boots package or Lloyd's package or Buttercups or whatever. Try and source different past papers from various different places, and anywhere you can find any help you can get is great. Remember that it's not just the BNF you need to look at, it's the MEP, it's the OTC, it's the SPCs and the calculations. The main point to remember is that all of this is useless, like a webinar, a YouTube video, going on expensive courses and training days. That's all useless if you're not coming home and putting the work in. That is the most important part, and that is your way to passing the exam. So put the work in. It takes a lot of effort and hard work, but you will get there. I have an additional tip. If you have trouble with your tutor or colleagues or anything like that, that kind of thing is normal. They want you, mostly in community, they want you there as a dispenser, and so obviously you are going to feel neglected and upset about not getting your study time and things like that. This is going to be one of the hardest times, studying and working, and I've realised that although lots of things can seem unfair, you're not going to be in that job forever. And once you do pass, you are free. So just keep that in mind. I know it can be stressful. Honestly, once you are a pharmacist, it's so worth it. And finally, as I always say, this exam is not representative of how you're going to be as a pharmacist. I know so many people that failed but have now passed and they're amazing pharmacists. And vice versa as well, people who have passed first time and aren't so great. So yeah, just make sure that you realise that this exam is not representative of you as a person or as a pharmacist, and just keep working hard and pushing through. I'd just like to thank Marvin and Umar for letting me join their webinar today and for giving me the platform to share my tips with everyone. If you guys have any tips to share with other people, or you want to ask any more questions, then just ask them in the comment section below and I'll get back to you. Thank you.
Most importantly, I really want to thank KOREginA. KOREginA, you've been fantastic.
You guys are amazing. Thank you so much. I've learnt a lot as well. I'm so happy that Marvin's just given me feedback on my section of the webinar. And I've got someone already telling me that they've made notes from my section.